Zoom recording. So just so everybody is aware, CODHA is going to record this discussion this evening with Peer Assistance Services, and we will utilize this discussion, questions and answers on our YouTube channel and direct people that may have questions about the program to this discussion that we'll have tonight. So my name is Amy Rezvani. Thank you for joining us this Tuesday evening. We are hosting tonight the Peer Assistance Program that here in Colorado is a program that is a nonprofit agency that is dedicated to, and this is a quote from the website here, quoted, dedicated to quality, accessible prevention and intervention services in workplaces and communities, which is focused on substance abuse and related issues. So we have a few representatives from the program with us tonight. And before we turn it over to them, I would like to introduce Laura Jacob, who is a hygienist on the Colorado Hygiene Association board, who is our liaison that does attend their assistance meetings and reports back to the board for us. So Laura, I will go ahead and turn it over to you.
Thank you, Amy. And I just want to applaud the Colorado Dental Hygienists Association for making this a priority tonight and opening up this discussion with peer assistance. I say this is my 43rd year in dentistry, which is amazing, but my 36th year as a hygienist. And I think I became aware of peer assistance immediately upon active participation in the association that fall. So they've just always been in the forefront of supporting the profession and professionals, and I hold them in such high regard. So I was aware of them early on, but really got to know them when I served on the State Board of Dental Examiners. That's what we called it back then, where I served for a decade. And really got to see firsthand the beautiful work they did in helping licensees, dentists, and hygienists work through difficult situations and heal and maintain their licenses and move forward. So I have the utmost respect and consider both of our guests tonight friends. A lot of history. So I think, rather than me blather on about both of them, because I could do that for a long time, I'm just going to invite Elizabeth Pace and Catherine Garcia to introduce themselves and then share for maybe 15 or 20 minutes about the program and the relationship with the Hygiene Association and the benefits. And then we're going to move into sharing from one of our members who's had firsthand experience with the program. And then we'll end with a question and answer. So if somebody has a burning question, you can either put it in the chat or raise your hand. We're a small group so far. I think we can be casual and intimate that way. Otherwise, just know that's our timeline and that's what we're moving into. So Elizabeth and Catherine, I'll let you take it away.
Well, I'll just take a minute, Laura. It is great to see all of you. Some of you I know, and I see Deb Athstra's name there. And individuals, both of you, who are longtime supporters of the agency and this effort to help all of our colleagues with issues that affect their practice, that affect their health. I'm the CEO of Peer Assistance and helped to start the organization. I'm an old nurse, an old med-surg nurse. Both of those things are true. And so we've worked with many professions over the years. And one of the first professions, well, I think the first one was maybe pharmacists, but the second one outside of nurses was the dental profession. And then I got to know Kim and Deb and Laura from the dental board, and great support from the board as well as your professional organizations. So we are very glad to present, be available for a conversation and talk to you all moving forward. So I'll turn this over to our clinical manager of our peer health assistance programs, to Catherine Garcia.
Hi, everyone. It's really nice to meet you all. And like Elizabeth, definitely see some familiar names and faces. So it's great to see you again. I am the clinical manager for the Peer Health Assistance programs, and my background is in psychology and social work, and I'm a licensed addiction counselor in Colorado. I really began working with the dental profession in 2014 and have kind of stuck around with this profession since then, as I've moved through different roles within the agency, just because of lots of people I've met, relationships that have been built, and just a big passion for working with this profession specifically. So thank you very much for having us in this meeting today to talk to you about the program, our services, and how they work and can work for dental hygienists in the state. So I'm going to talk to you a little bit. I promise not to talk to you too much. So in the beginning intro, I'm going to actually let a peer health assistance program video give you some information where you can also hear from not only me, but also some of the clients that have gone through the program. So I'm going to share my screen. If you don't get audio right away, please let me know. Or if you don't have any audio, please let me know. Just wave your hands or put something in the chat and I will fix that, but you should be able to get that.
The Department of Regulatory Agencies Division of Professions and Occupations, or DORA, provides consumer protection through its regulation of more than 500,000 licensees within more than 50 professions, occupations, and businesses in the state of Colorado. DORA's mission is consumer protection, which is implemented through licensure and certification of health and mental health providers. Pursuant to their respective practice acts, DORA contracts with Peer Assistance Services, or PAS, to provide peer health assistance programs for the State Board of Nursing, the State Board of Pharmacy, the State Board of Veterinary Medicine, the Colorado Dental Board, and the Colorado Mental Health Boards. PAS leads with prevention and intervention for substance use and mental health concerns. Health and mental health professionals throughout our diverse state have access to comprehensive evaluation, referral to appropriate levels of care, and case management. Peer health assistance programs emerged in the 1980s to enhance public protection by promoting earlier identification and intervention before professionals demonstrated unsafe practices. These programs are structured and supportive for healthcare professionals with illnesses that impair their practice. These programs provide evaluation, referral to treatment, case management, and monitoring of the professional throughout treatment and recovery. Health and mental health professionals, like the general population, experience substance use and mental health-related problems. Referred professionals are supported throughout their recovery, maintaining their professional practice while safeguarding the health of the community. Early intervention with these illnesses is critical. Peer Assistance Services provides an effective model for recovery and return to practice for those with substance use, mental health disorders, and other practice-affecting issues. Through evaluation, treatment, and monitoring, individuals can regain their lives and livelihoods as trusted health and mental health professionals.
The end result of addiction is death. And we've had way too many of my colleagues that I've known that are not with us anymore because people were afraid they were going to get them in trouble. And that's totally unacceptable to me.
Peer Assistance Services is a chance to get better and to literally save your life.
In my addiction, I had problems with depression and, considered suicide, and no one ever used to talk about it before.
We need to ask for help, and it's very difficult for us to do. And I think I find that in most of the healthcare professions. We're all really high achievers, and we got there through a strong drive to succeed.
For me, this is what's going in my mind. I'm a pharmacist, I'm a professional, I should know better. My life will be over if I ask for help.
I got busted diverting and was referred to Peer Assistance.
I was working in a pharmacy. I was diverting hydrocodone. I couldn't stop obsessing about it. So I knew I was truly addicted.
When I moved to Colorado from Michigan, when I applied for licensure here, they asked questions. Did you ever have a drug problem? Did you ever have an alcohol problem? Peer Assistance was contracted by the Board of Dentistry to evaluate and monitor people with past history of problems, monitoring contract with them for 3 years. You know, I had to do all sorts of things that helped strengthen my recovery.
Generally, you get an evaluation, referral for appropriate treatment if it's indicated, and then peer is a monitoring and accountability / support program that lets the board know that you're still doing the things that you need to do to treat your disease and that you're safe to work.
Being able to connect with others and build that support system, it can be challenging in a rural community. Not everyone thinks of being in a monitoring program as you know, something that's great, but I saw it as an opportunity. I knew I needed help, and I was glad that there was people in a program set up to support me.
Random drug tests, alcohol tests. I had counselors that I had to see. I had recovery meetings. I found it to be very helpful. And so when I graduated from the program, I stayed on to help and became the point person in Colorado to answer the phone when somebody calls.
They've been trained specifically for the issues that we face, compassion fatigue and forgetting to take care of our own needs as healthcare workers, because we're so apt to put the needs of others before ourselves.
Peer assistance held me accountable. Otherwise, I wouldn't have gotten well.
You don't just have to take my word for it. Like, here's evidence that I'm safe to practice and I'm a good nurse who has a really wicked disease. And if anyone should understand that, it's people who work in the healthcare industry.
Without a supportive program, people won't come forward. The only way for people to get help who are in the healthcare profession would be punitive measures. And, you know, you get arrested at work. That's a bad day.
We do recover. People do recover. They do get better and they do get their lives on track.
It's a disease, but I did not think that then. I know that now. Peer assistance was a lifesaver for me.
They were there to ensure that I will not only practice at the highest level, but they wanted me to live my best life too.
We're at Northfield Veterinary Hospital, and I am the owner and lead veterinarian here. This is my project and my baby. I'm very proud of it. I would hire a peer assistant graduate in a heartbeat. They really do allow people who have struggles get back on their feet, to get back into the profession that needs them.
This is a brain-based disorder. Evidence-based treatments are available. Nurses and others can recover. They can return to the workforce and they can be healthy, productive members of providing that health care.
I got sober in 2001, so I started out as a client of Peer Assistance Services. I was able to be supported through an amazing organization like Peer Assistance Services, and I was able to get my life back on track. And I'd just like to think that the world's a better place because I was willing to fight for it.
We have very little in the nursing curricula that prepares nurses to work with this population of individuals with mental health and substance use disorders. If we're not integrating this into healthcare practice, an evidence-based intervention that's not being widely used to prevent that progression of substance use, and if we're not testing on the exam, then we're not doing a justice to preparing nurses for the future to care for this population.
Sometimes you just have to be willing to give people a chance because they can be your best, most dedicated, emotionally vested people that you could ever have.
Stigma continues to be one of the largest barriers for people seeking treatment, oftentimes even acknowledging that they might need treatment. What I'm trying to do with the neurobiology is shift that paradigm to understanding this is a science-based paradigm. And nurses are not immune to those prejudices.
If you hire somebody who's under contract with peer assistance services, you're actually getting somebody that you can trust because they're being monitored by the board and by peer assistance services. They have to undergo a lot of testing and they have to undergo a lot of counseling. There shouldn't be the stigma associated with addiction and mental illness. We're all just people with a disease and we all need a chance because we can make beautiful things happen.
That was a beautiful video. I've not seen that before. Thank you for playing it, Catherine.
Yes, of course. So we released that video, I think, mid-2020, Elizabeth, I think. Mid-2020, worked on it for a while, but thought it was really important to get that out there, not only from our perspective, but from the perspective of multiple different professionals who have experience with the program. So I'm going to do another screen share. Can you all see that okay? Amy was able to read our mission to you all. So as it showed in the video, we do have two offices in the state. One is in Denver, that's our main office where most of our staff are located. And then we do have a small satellite office in Grand Junction to provide services to the western slope of the state. We are a statewide program, so we work with people all across Colorado. Since COVID began, we did transition all of our services to remote, which has actually worked really well for us in the ability to provide services, the same exact services to people in remote areas of the state. People don't have to travel to us. So it's actually worked really well. We're using a secure telehealth platform and able to meet with clients and still provide them all of the same services that we would have normally provided in person. We also do have a 24-hour information line I want to mention. And so that line is utilized in many different ways. It's not a crisis line, but it is utilized by our current clients if there is something that they're encountering they need help with. There's always a on-call staff, a clinician on call 24/7 that will either answer the phone when it rings or call back within 2 hours. The other piece it's utilized for, which could be useful for really anyone, is just consultation if a family member, colleague, friend of one of the professions we are working with is struggling with substance use or mental health issues, and an individual just wants some consultation on how to deal with that. Our staff will be able to provide that consultation as part of the program services. This is a list of our program staff. So we do have a majority of our staff are licensed mental health professionals. All of our evaluators are clinicians who are conducting the initial evaluations into the program. And then we have a team of case managers who work with all of the professionals coming into our program. So briefly, I just want to talk about our scope of work. So one of the big takeaways of the peer health programs is the peer health programs themselves are not treatment, and we don't do any of the treatment in-house. We do conduct a thorough biopsychosocial safety to practice evaluation, and that's typically where we see a lot of hygienists referred to the program. It's typically around that evaluation where there's maybe something, a yes box checked on the application for licensure, reporting a DUI in the history, or something of that nature, a substance use issue or a mental health issue in the past, where then the dental board is flagged that there's something they would like more information on. So they will refer to the program and gets this independent, neutral evaluation of the individual and their safety to practice to help inform their decision around licensure, or if there's a complaint filed on a hygienist, they will also refer to the program. So that's typically where our hygienists are accessing the program at currently. And if we do determine, our evaluations are conducted specifically from a physical, mental health, and substance use aspect. So we're looking at all of those things and really determining, is there a condition that is affecting someone's practice or will affect their ability to practice if it's not addressed. So if we do find something that is affecting practice, we can recommend case management and monitoring. And the average for that is typically about 3 to 5 years that someone's on monitoring with PAS. And in that time, they are receiving support and guidance from a case manager, referrals to treatments, monitoring compliance. A lot of clients that are working with the program are mandated by their regulatory board. So there's regular reporting back to the dental board to assure them that an individual is safe to practice. And so everything looks really different. It's very individualized for each person working with us, what their monitoring will entail, and it will change throughout the entire length of monitoring as people progress through treatment and other resources. So we will always work with clients to provide them exactly the resources and services and treatment that they need at that time. And then the other piece is the education and outreach piece. And so that's where we go out into the community and talk about these issues, talk about substance use and mental health and how it can affect practice and these programs and how they work and how people can refer themselves or their colleagues. And really the intent of our education and outreach is a big strive on prevention. We want to be able to get people much sooner than when we see them hit our doorstep. Typically, when we see people, if they're referred by the board at that point, a lot of times they have a complaint that's pending, may have some criminal charges going, have lost things, their family, friends, employment, and the last thing they have is their professional license. And so a lot of, or all of our education and outreach is really to provide that education for that prevention aspect, because if we can get to people sooner, before any of that happens, we can prevent that whole spiral that we tend to see when we get referrals to the program. I'm just going to briefly touch on the Dental Practice Act and the statute and how some of the wording that's in the Dentist and Dental Hygienist Practice Act around the Peer Health Assistance Program. So currently, since dental hygienists are not part of the program and not paying into the program like dentists do with their license fees, it's called in statute, the Dentist Peer Health Assistance Program. So this is language directly from the statute. So as the condition of renewal in the state, every applicant shall pay a fee selected by the board not to exceed $59 per year. So I think when we first connected, Laura referenced this, and this has always been a concern with the fee. And so right now, I don't know exactly what dentists are paying, but the fee fluctuates based on the board and based on the number of licensees. So a lot of things can fluctuate that fee. I can say in my history working with the program, I have never ever seen dentists pay $59 per year. Typically, what I've always seen is $40 every renewal, so $20 a year is what we've historically seen dentists pay. And then the second bullet is really the scope of the program, and the intent of the program is to provide the assistance, education, evaluation, referrals to treatment, monitoring, and really concerning physical, emotional, and psychological problems. The other piece of the act that I thought was really important to highlight, because it's unique to the dental profession, is this piece. So a few years ago, and Elizabeth will have to help me with dates, but maybe 3-4 years ago, dentists actually got together and they put this in their own act. It was really important to the dental profession that if one of their colleagues was arrested for drug and alcohol related offense, a DUI, anything of that nature, that they referred to the program quickly. So it was important to them on numerous aspects. Number one is that colleague of theirs or that dentist getting help and really getting treatment early and having someone to intervene and really provide them assistance. But the other piece was really looking at the patient safety aspect. And if someone really is struggling with a substance use disorder that's resulting in criminal charges, the criminal process takes potentially years for it to go through that court system. And so there was a big concern from the dental community, if someone really does have one of these problems, we don't want them to be out there practicing on patients, potentially putting patients at risk. So this has worked really well. Since it went into the act, we get a large number of dentists that refer themselves to the program when something like this occurs. And by the time some of those board processes and things run around, they could potentially be completed with any requirements of the program. So it's actually worked out really well. Dentists, I think, have such, and just the dental community in general has a really supportive environment, and providing help and assistance to all colleagues, everyone in the dental community is really important. So with that, that's all I had, because I did think that it would be helpful for us to maybe take some time to answer any questions about anything I talked about, or just in general on how the program works and how we currently work with hygienists. I can tell you we do work with a significant number of hygienists, and like I said, typically where we see those referrals, and we have seen it trickle up in the past 5 or so years, is coming from the dental board in regards to a application for licensure. So what we tend to see is a hygienist graduates or from hygiene school and applies for that initial license, and maybe during college they had a DUI or something like that, and they have to report that to the board. And so we do a lot of education work within the dental hygiene schools as well, to really prepare students to understand that these things that occur do affect you, and they will affect your licensure because of the obligation to report these things to your board and the patient safety aspect. So that's where we tend to see a lot of hygienists. A lot of times it's, maybe a one-time offense, but we do monitor hygienists as well. And so I think the big struggle around that is because hygienists are not part of the program and don't pay with that licensing fees, they do have to pay for all of our services on a fee-for-service basis, whereas dentists don't. So when a dental hygienist applies for a license in the state and is told by the board you have to do this evaluation, they have to pay $1,500 for the evaluation. And if they don't, then the dental board won't even consider giving them that license if they don't follow the evaluation process. So that's definitely a huge barrier, especially as someone's coming out of hygiene school, very young, looking for a job in hygiene, have student loans. And so that's definitely a big barrier. And when someone has to be monitored, which the dental board can order a hygienist to monitoring in the program as well, they do have to pay that monitoring fee for all of the services, case management services we're providing. So they do have to pay $50 a month. So when you add that up through a 3 or 5 year length of monitoring, that's a pretty significant amount that is being paid for the service.
Good. Thank you, Catherine. You did such a good job of summarizing so much information and giving us those details. I will save some more time at the end for question and answer unless somebody's got a burning question right now. I just feel, I try not to use the word blessed when I'm working in professional meetings, but I really feel like we're blessed that Justin is willing to share his story tonight. And Justin, I know we could spend hours talking about all that you've been through in multiple states and experiences, but if you could give us a, like a 10-minute sharing of your story and your experiences in other states, specifically with the peer assistance programs, that would be awesome. And thank you so much for your vulnerability. You're still on mute, Justin. Uh-oh. There we go.
There
There
we
you
go. Sorry. Yeah, no, I'm glad I could maybe help step in, since dental hygiene is really not that involved as far as with peer assistances or services like I was in Montana. Montana, everything was paid for. Our dues also went to help pay for it, just like the dentist. So, I originally went into a monitoring program in Montana in 2015. I had got back into drinking again and got through a divorce and kind of ruined some relationships and didn't want to do that anymore. And I got to the point where I would wake up and my truck was on the front lawn and not in the driveway. And that's when I realized that I needed a change. And I didn't want to get a DUI. I didn't want to have to go in front of a judge. I didn't, my license was everything I had at that point, so that was the driving factor. And I think that's a lot for most dentists, hygienists, pharmacists, doctors, anybody that goes through these programs. And so when I had originally went into the Montana Professional Assistance Program in 2011 when I got my license, and because I had underage tickets in college during my undergrad, just because I had those on there, I was sober at that time, that I had to do a 1-year monitoring program, and I became familiar with the Montana Professional Assistance Program, and I felt comfortable enough to go back to them and say I need help, and so because I was a self-referral, I hadn't been in trouble, there's anonymity that comes in with that, and wasn't reported to the dental board there. And then I found this job down here in Alamosa that had student loan repayment, and I had a large amount of that, so I decided to transfer down to get my Colorado license and apply. And when you transfer states like that, you then have to report it to the dental board. You can't just go from MPAP to peer assistance with that anonymity anymore. And so that that was a little bit of a sour taste in my mouth, but it is what it is. I wanted that student loan repayment bad enough that I was willing to go in and I had to pay I thought it was $1,200, 5 years ago. Maybe it was $1,500. I don't remember how much it was, but I had to max out a credit card to be able to do it. I wasn't financially in a position to do that. And so that was a big burden. And then the monthly fees that went along with it, that was completely different than the Montana Professional Assistance Program that I was in. And so I had to really budget and make that work. And so that it is what it is. If you want to practice in Colorado, that's the hoops you jump through. But coming in with peer assistance, it's been great. They've gone to bat for me a few times. There was a few instances where I drank too much water that day, and when I went to take a UA, had a diluted UA. I mean, just barely passed the line, but still, when you sign that paper, you sign a contract that you're going to follow these regulations. You're going to stay within the bounds of that contract, and when you step outside of that bound, you have to they're going to hold you accountable for it, and that's part of sobriety as well. You personal inventory step 10, constantly helps you understand that you need to make sure you're living within those bounds. And so for me, it was, like I said, it left a little bit of a bitter taste in my mouth because they made me sign up again for another 5-year program. And that was in 2018. So, I will have done 8 years of monitoring by the time I'm done, which I think is a little excessive, but that's a conversation for another time. The main thing is that I'm sober. I'll be sober 6 years in July, and I've got my license. I've got a family. I got remarried, and it helped me build that foundation to get back on my feet, stay on my feet, and not kind of self-implode again and go back into that addiction. I had somebody there to hold me accountable, which is exactly what I needed for those years. And I'm committed to that contract now, and I'm going to finish it out. And I thought for a while I was just going to come down to Colorado, get my student loans paid off, and go back to Montana, but things have changed. We found a job that's really suitable for what we want out of our lifestyle outside of work. The go play lifestyle. It gives us good benefits, and we like the quiet life down here in the San Luis Valley. So that's where we decided to buy a home and raise some kids for now. So it's been good. I mean, I know Catherine through name. I've never really met her. I just know I used to send paperwork to her, and now I have a different case manager. But Peer assistance has definitely been what I've needed myself. As much as I don't want to face sometimes, I don't want to pay the fee sometime. It's been great for me. And so, I would like to encourage anybody that is struggling to self-referral before you get into that trouble. And for a while I thought, if anybody self-referred like I did, they were going to have to report to the dental board, and I wouldn't do that. If I knowingly had to self-report and then have the dental board be told, I probably wouldn't. But I didn't understand that, and Laura kind of helped me understand that any dental professional or any nurse, anybody that's involved with it, can go self-referral and have that anonymity to seek treatment. But if you step outside those bounds that you have signed into, then you will be reported to the board. But that's part of sobriety, is being held accountable, and helping you stay within those boundaries. So I would definitely advocate for anybody to be able to seek that help if they need to. Don't let the DUI, don't let your name be dragged through the mud and everything else that goes with it. Get that help that you need now. I don't know if there's any more, Laura, that you're looking for. I know we had a little bit of conversation a while back, but
Yeah.
I had the opportunity to go up to Alaska and get my license up there. I kind of do a little side work up there, and they didn't have a monitoring program, but they have an epidemic of abuse amongst healthcare professionals up there, especially ones that are, and it turned into a whole conversation. Instead of me trying to plead my case of why I wanted a license, it was, hey, sit down and tell us, how does this go in Colorado? How are you guys doing? Who's the company that you're doing? So I was able to kind of give them a breakdown of how Montana and Colorado has that program and help guide them into starting something. And now how far they've got off the ground with it, I'm not sure, but I mean, that was a few years ago. So I mean, it's not a problem isolated here or there. It's everywhere. I'm sure everyone here can name a dad, an uncle, an aunt, a mom, a grandma, grandparent, a sibling, or a best friend or a cousin who is struggling with alcohol or drugs. I don't care who you are. I guarantee you know someone. And when I got out of hygiene school, there were 60 girls in our class. Well, 57, and me and 2 guys. And you didn't realize that a third of them were using substances. They were drinking themselves to death during school. Like, everybody kind of put that best foot forward, but afterwards you kind of get out and you start to realize that, there's a lot of girls that were struggling in hygiene school. I myself was one of them. And so it's a program that that word needs to be put out. It needs to be embraced and not so much looked down upon, but hey, this is a way out, because it's pretty rampant. So.
Well, thank you, Justin. Again, I just applaud your vulnerability and your sobriety and your perseverance. So thank you for sharing. I wanted to clarify one thing you said. When you had to sign another 5-year contract, that was the doing of the Colorado Dental Board. That wasn't the peer assistance.
It wasn't peer assistance that did it. It was the Colorado Dental Board, and they're a little extreme in this state compared to other states, yes, but again, it is what it is. So we don't make the decision who makes those decisions up there. So
right. I just wanted to make sure everyone in this meeting was clear on that peer assistance was behind you and your commitment, and it was a board decision. There's been a lot of turnover on the board as far as the administration. And so I'm just hoping for a little more consistency and a little more openness and willingness to be compassionate towards the participants in peer assistance. So I think the other thing that I haven't necessarily heard clearly, but I always like to emphasize, and correct me if I'm wrong, but we know that addiction affects 20% of the population, right? And so the dentists have embraced this and said, we're going to take care of it, and the law is protecting them. And so for us to turn a blind eye and say, well, not hygienists, we're too type A, this wouldn't affect us. You heard in the video that Catherine shared that they were all professionals that had those high standards, and they still succumb to it. So we just have to embrace that this is the right thing to do, to support that 20% and let the whole share the burden of the cost. So it's my intention to support the board in moving forward with the board approving this and then the House of Delegates and then taking it legislatively so that we would change that law. So it didn't say the dentist peer health program, but it's the dentist and dental hygienist. And that would make my heart, I feel like I've been having this conversation for 20 years and it's just time to move forward. So that is my intention. And I think you could hear from Justin's story, the difference in the willingness and the ease that it was in Montana, and the expense and the regulation and the lack of empathy that he's experienced here in Colorado. So that too is my goal. I think the other thing that we tend to associate peer assistance with is just drug and alcohol addiction. But you saw that one slide, and I'm so glad that you put it up, Catherine, that it is also about mental health and well-being. And in today's society, we are shining a light on mental health issues, but we are, as professionals, healthcare professionals, under tremendous amount of stress. This year has been brutal, but it just keeps going. We just keep giving and giving. And so to not recognize that our work could be affected by our mental health because of that emotional stress or disease. And peer assistance is there to be a supportive. But right now, if I call and say, can I be evaluated? It's got a $1,500 price tag. If we move forward with this and we share the burden of the cost, I can go in for an evaluation and they can help by saying, boy, you're having a rough time. You're right. You need to go cry. Or, wow, I think you need, layers. What level of support do you need to be a competent and confident practitioner? So I just like to remember that there's two sides of that. And I wanted to say to Justin, thank you for saying that also, that I don't know anybody whose life hasn't been affected by addiction. I am the ex-spouse of an addict, and I'm the parent of a recovering addict. So it's touched my life very closely. And I'm so grateful for the knowledge I gained from peer assistance and being part of this. So we were supposed to wrap up here in 3 minutes, but I really want to honor or give everyone the chance to ask questions while we have Catherine and Elizabeth right here. Anybody?
I have a question. Yeah. Go ahead. No, Sherry. Sherry, go ahead. I guess I'm not as much understanding the mental health part of it. Are there any examples of what a mental health situation with peer assistance would be?
Yeah, so that's something that also has to be reported to the regulatory board when you renew. There's typically a question on, have you been diagnosed or treated for a mental health disorder since your last renewal or in the past 5 years? And so what those really look like is someone who's struggling with something like severe anxiety may have issues with cognitive functioning due to those intrusive thoughts and repeated thoughts, and really struggle at work with attention and focus and detail. And so that's where we would look at, is this affecting work? How can it affect someone's work? And what we typically see with substance use is there's typically an underlying issue with substance use, which is usually a mental health disorder, sometimes stemming from a physical condition with prescribed medications, or even trauma throughout the history of someone's life. So our evaluations and our program really looks at everything, the person as a whole. Nothing should be siloed out and treated separately. Everyone's a whole person. So we really look at the whole entire person and figure out what's really going on and what's leading to these things and how is it impacting work. And if it is impacting work or just any other aspect of life, how can we get you the help that you need?
Okay. So if a person, let's say they did that, and it was determined they must do, say, therapy, Does the peer assistance program, I know not right now, but if hygienists were participating in it, say if we were dentists right now, would that be paid for? Like the evaluation is paid for, or like if you were prescribed, you needed to do therapy for your program, that you would have to pay for it on your own?
So all of the referrals are self-pay for all clients. So the program and those fees that are tied to licensure only cover the services of peer assistance directly. So they cover the evaluation, the case management, the referrals, and the monitoring, and the reporting back to the board if the board is involved or not. Laura mentioned people being able to access unknown to the board, and that is true. And a lot, the reason we don't see hygienists typically do that is because, you know, if paying $1,500 for an eval to get your licenses ordered by the board is a little different than saying, I really, really need help, and paying $1,500 for that eval. So we don't tend to see that a lot with hygienists, but those licensing fees specifically, whatever the board would set them to be, would only cover our services. And it's the same for dentists. They pay for their own treatment. They pay for their own drug testing, anything that a service that they would need outside of our services.
Oh, okay. So for hygienists, I guess I don't remember when we renew our license, it asks us if we've been diagnosed with a mental health condition.
Yes.
Oh, okay. I'm just not remembering that.
You have to you have to sign an attestation to that.
Oh, I only remember paying.
Thank you, Catherine, and thank you, Sherry. I think Deb had a question.
It's not really a question. It's wonderful to see Elizabeth and Catherine. It's been a long time. And I became aware of peer assistance when I went on the state board in 1986 and was very impressed with the organization, and was very honored when I went off the board that peer assistance asked me to serve on their board of directors.
Yep.
For quite a few years.
Quite a few years, yep.
Yeah. And I must say that at that time, there really weren't, and I'm talking about late 80s, maybe early 90s, there weren't very many dental hygienists that were referred to peer assistance. I mean, we're talking single numbers over a 5-year time span. So at that time, I was not that supportive of including dental hygienists because of the cost factor. And I thought it would be a difficult time to get the support from dental hygienists to be paying when there were so few. Times have changed. And I have to say I'm 100% in support of our organization going forward and trying to pursue legislation to include us in this program. And as some of you know, I'm working with a bill that we have right now in the legislature. I think this would be an easy bill for us to move forward with. I think we have to take a look at, do we want to go forward with a bill prior to the next sunset? Or do we want to wait till sunset and do it? But I hope that our organization would want to move forward with the concept and then make those decisions with peer assistance when would be the best time to do it legislatively. That was it.
Thank you, Deb. And thank you for your great support and your leadership with that. And I think that's something the board can decide, you know, time-wise with the legislative committee, what makes the most sense but I do believe it would be supported by the Dental Association. And so we would go arm in arm, and that's a nice feeling. Any other questions from anybody? No. Well, I'll say that I was humbled yesterday. I get to be a vaccinator tomorrow for the first time, but I had to do a drug test yesterday. So everybody should have to do a drug test once in their life. It was very humbling. I'll just say that. Anything else anybody else wants to share? Yes. Tabitha. I think you're still on mute. There you go.
Okay, sorry, I clicked it, but it wouldn't. Anyway, so Deb, you said that, you know, in the late 80s, early 90s, there were, you know, the single digits. There were so few hygienists being referred. How many are there now, approximately?
That would be something that Catherine or Elizabeth would have to respond to, because I don't have that kind of information. But I know in conversations over the years, the few recent years, that there have been more hygienists that are receiving services through peer assistance, whether it be self-report or board referred.
Currently, I can tell you we are actively monitoring 5 hygienists that are monitored by us, and that is required by the dental board. And to date, this fiscal year through December, so our first 6 months, we served 7 hygienists. And so that could be anything from evaluation to monitoring. There are definitely some years where there's upwards of 30 that we are at least evaluating. And I think I mentioned when I was talking earlier that a lot of times it's only that evaluation, because we tend to get people at that application stage. And if there is a slight concern, if we see like someone maybe will go down this path, we can still do that psychoeducation as part of the evaluation, give them additional information and support, but we may not necessarily recommend monitoring. And so right now, actively, like today, there's 5 that are being monitored.
Thank you.
That's a great question. Anybody else? Anything?
I was just going to say, it kind of goes with Tabitha's question too. I was looking up board discipline for something else that Deb and Kim and I were working on, but going back to like the 90s, there's only about 35 hygienists that are on this list that have had discipline for the board, and 14 of them were substance abuse related. And so that shows, and they were all in the last like 10 years with the exception of 1. So that shows you, like Deb said, that this is definitely more of an issue now than maybe in the past. And then again, these are only the people who had board discipline. So it'd be really great to be able to provide services to people before that point, and let them know that they have this option before they get to the point of having to have board discipline and be forced into it. So thanks for presenting, guys.
I'll piggyback on what Alyssa said and take it even a step further, which Catherine mentioned, but a big focus of peer assistance is speaking to each of our dental hygiene programs in the state every year, because just as Justin mentioned, there's a lot of use and abuse and mental health issues in school. So if we can catch them early, hopefully they won't have to struggle in even getting their license, much less being of danger to the public. So I just applaud that effort, and I know CODHA can be a partner in that as well. So I know it's part of our annual session when we speak to the students, always bringing that in.
Laura, I'd like to add a comment before you wrap up. All of these programs for the professions, health and mental health professions, really the genesis, while they're regulatory, the genesis of them were the professions themselves. And because just like you experienced, because you're excluded. And that was a decision in the early 90s to exclude hygienists from the peer health program because of prevalence or incidence or whatever. That the profession themselves moved this forward, had to adopt it within their Practice Act. And it's without it, the option is discipline, public sanction essentially, for a health issue. These are serious mental health, substance use disorder. They are serious life-threatening health issues, and all exacerbated, I would remind you, by COVID. And you will see that going forward. We've already seen the just incredible increase in alcohol and other drug use, in profound depression. So I think that's one way to look at this. Yes, it costs some money on our license fees, but it is a professional effort that we recognize that these health issues can happen to us just like anybody else. And that we adopt these methods. We wish to be regulated because we're held to a high standard. So that's what government helps us do. But adopting these programs recognizes these health issues that can affect our practice. And so I do think that that's an important way to look at it. I also can't stress enough that going forward, we are going to see more and more and more. You'll see it in your patients. It may show up as subtle signs and symptoms, but increasing substance use because of the stress, anxiety, and the illness itself with coronavirus going forward for some time to come. So that's sort of my pitch. That's as a nurse, when we started this in the early, let's say, I don't even know what year it was 1984, I guess we incorporated, but we wanted something, we did not want nurses kind of hung out there, always disciplined, always being public for these issues that other people were able to get treatment and cared for. And so that's what we need to do for each other.
Thank you, Elizabeth. Thank you, Catherine. Thank you, Justin. Thank you, Amy, for facilitating, for Lisa, Alyssa, Val, for making this priority, for Sherry and Tabitha. And I think I got everybody for participating, Howard for participating. I'm just hold everyone here in such high regard, and I'm so grateful for this conversation. So thank you for giving us an hour, and we'll keep moving. So.
Yeah, I was going to say, just to end on a positive note, if anybody wants a Springer Spaniel, we got a whole bunch of them.
Oh, it's so fun to see the puppies. I think when we spoke a few weeks ago, they were just being born.
Yeah, it's the best now. It's too much work.
Beautiful. Gotta remember the good stuff. Celebrate the good stuff.
That is an awesome positive note. Thank you, Justin, for that. And thank you, everyone, for spending a bit of your evening with us. And thanks so much to Peer Assistance for everything that you do and sharing a little bit more with us and letting us record so that we can expand to the broader community. And I definitely look forward to moving forward, adopting the fee. I think what better way to support each other and support our profession. So thanks so much, Laura. Thanks so much, Justin and Catherine and Miss Elizabeth. And everybody have a great evening. Bye-bye.